Madam President, next couple of days we're going to have a chance to vote on Obamacare. And this will be an opportunity for us to allow our views to be expressed on both sides of the aisle. I'm glad we're going to have that opportunity. We'll see what happens, but I think it's certainly an opportunity for us to have a good debate about why we think it's important for us not just to change Obamacare, but actually to start over and do this right. It's a time for us to undo the mistake that this Senate made 3 years ago when that legislation was jammed through the process without a single Republican vote, by the way, which is something that the American people are tired of. The partisanship in that particular vote, I think, has led to a bad result. Obamacare was sold, by the way, to the nation under false pretenses. We were promised that Obamacare would bring premiums down. You remember those discussions that this is a way to get health care costs down and reduce premiums. In fact, what we're learning, and there's a new report out this week, premiums are going up. We were promised that Americans would be able to keep the insurance they have, and that was a specific commitment made. And yet millions of Americans are losing the insurance that they have. And it's insurance that they like, and they can't keep it. We were promised that if you like your doctor, you can keep your doctor. Everything will be fine, when in fact, again, many Ohioans and many Americans are losing their doctor. We were also told that Obamacare would help grow the economy and create jobs. And unfortunately, just the opposite is happening. More Americans are looking for work because many of the jobs that are available now are part-time, in part because of Obamacare encouraging more part-time work. There are companies that aren't expanding because they don't want to reach that magic 50 employees. And as we talk today, we are learning that there's even more problems with the implementation of Obamacare. Recall that one of the Democrat colleagues here on the floor said that he thought this implementation was going to be difficult. In fact, one Democrat who was prominent in the legislation said it's likely to be a train wreck. Well, unfortunately, that train wreck is occurring. We see the District of Columbia, this week making changes. We see today, apparently, the administration now saying that the small business part of the exchanges isn't going to go forward as planned. We've already seen a one-year delay in terms of the business mandate, and on and on. So that train wreck is already upon us as we move toward October 1st. Let me give you one example of the impact of Obamacare. In Columbus, Ohio, my home state of Ohio, the Wall Street Journal reported that premiums could increase by as much as 436%. Now, some of my colleagues will take issue with that number. Maybe it's not going to be 436%, but the point is, we know it's going to be more expensive, we just don't know how much. And that's part of the uncertainty that the law creates. In other words, sometimes uncertainty is the worst thing, and that's what we're seeing, not just in Ohio, but around the country. We don't know what the effect is going to be on our families. We don't know what the effect is going to be on small businesses. We don't know what the effect is going to be on our economy. Throughout this debate over the continuing resolution, my colleagues on this side of the aisle have talked about this uncertainty. They have talked about how a showdown going up to a potential government shutdown creates uncertainty in the economy. And I agree. I don't think we should shut down. And in fact, I'm offering an amendment to say that we should never be shutting down government. It's called No Government Shutdown Amendment. It's bipartisan. In the budget debate, we actually had a few Democrats support it, I'm sure against the urging of their leadership, and I appreciate that. Uncertainty is a problem. But boy, talk about uncertainty. Again, in the implementation, you have some things delayed, other things not delayed, a lot of confusion about how the legislation is going to work. Every day it seems like we discover a new wrinkle in the law that's going to cost more money and cause more problems in terms of people just understanding what their options are. And the effects of Obamacare, by the way, don't stop at the hospital door, and they aren't just limited to our pocketbooks. If you ask Americans what's the most important issue to them, they'll tell you it's the lack of good jobs in the economy. Obamacare kills jobs. Take the Cleveland Clinic. Cleveland Clinic, as some of you know, is the largest employer in Northeast Ohio. It's been talked about on the floor by other members. They have about 40,000 employees. And by the way, it's one of the few things that both President Obama and Governor Romney agreed on in the campaign, which was that the Cleveland Clinic is providing cutting-edge health care that should be a model for the rest of the country. They do a terrific job there. A week ago, the Cleveland Clinic announced it's cutting $330 million from its budget. What does that mean? Well, that means a bunch of my constituents from the Cleveland area are going to lose a job. And why is the Cleveland Clinic having to cut $330 million from their budget? According to their own spokesperson, to prepare for increased costs and decreased revenues because of Obamacare. So, look, it's something I've heard about again and again when I visit with small business owners throughout Ohio. I hear it from our employers who say they've got no choice but to freeze growth. I have a friend who runs a small company in the Cleveland area. He's got 47 employees. And he has confided in me, you know what, I'm not going to 50, even though I've got some additional business. He's starting to see a little pickup in his particular sector. He says, I'm not going there. I don't want to get to 50 because I simply don't want the uncertainty and the costs associated with the new mandates and requirements that I would have to endure because of Obamacare. So you have the 49ers, employers who are sticking at 49 or less because they don't want the onerous requirements of Obamacare when they cross that threshold of 50 employees. Others, of course, are reducing hours by folks who already work for them to 40 hours or well under 40 hours because they've got to get under the 30-hour-a-week, again, threshold in Obamacare. So very sad, you know, to go to somebody and say, you know what, you got to come in at 28 hours now because the health care that I'm going to have to offer under Obamacare is not something I can afford, doesn't fit with our bottom line. And this person is saying, I got a car payment or I got a house payment. This is sad, and it is having an effect. I will tell you in my state, and I know it from talking to people, but I also know it just by looking at what these requirements are doing to small businesses. It's no surprise to me that this underemployment figure we see every month in the employment numbers is growing. That's the people who are not working full-time, but working part-time. Unfortunately, if you look over the last few months, we've seen a big increase in part-time jobs and not full-time jobs. Mr. President, or Madam President, in 2010, I don't think that many of my Democratic friends thought they were voting for a bill that would kill jobs. I really don't. I don't think they would have voted for it. I can't believe that they thought that Obamacare would drive up premium costs and make health care harder to get, as it has. But that is what's happening, and that's why I believe it needs to be repealed and replaced with more sensible reforms. The current health care system, before Obamacare, far from perfect, cries out for reform. But unfortunately, the prescription of Obamacare is not making things better, but worse. I know this is hard to believe, but sometimes Congress makes mistakes. And in this case, in my view, Congress made a big mistake. But we can fix it, and we can replace it with real bipartisan health care reform that does foster an environment where jobs can be created, that does provide for health care to be available, rather than harder and harder to get. We can get there, but only if we start by, in this vote today, saying, let's defund it, let's repeal it, let's replace it with something better. As we learn more about the effects of Obamacare, we're seeing some courage on the other side of the aisle. I know one of my colleagues today on the Democratic side said he could look to delaying Obamacare individual mandate for a year, for instance. And that only makes sense. I mean, we've already told the businesses they're going to get a one-year delay, but a woman or a guy that works at that business is told you've got a mandate, even though your business doesn't, and you've got to pay a fine if you don't get health care. So 22 House Democrats voted in favor of delaying the individual mandate as well. So I think on both sides of the aisle, you're beginning to see some interest in at least having a delay to be able to try to improve this legislation. But the Senate has the opportunity to speak here this afternoon. We're going to vote on this amendment as to whether or not to defund Obamacare. I've heard from my constituents. I'm sure you've heard from yours. Overwhelmingly, to my colleagues, what I'm hearing is they don't want this law to continue. Do they think the health care system is perfect? No. But again, they think that what Obamacare is offering makes it worse, not better. Republicans can't do it alone. We've got 46 votes here. You need 60. But in an act of bipartisanship and real political courage, maybe we'll have a good result this afternoon and begin this process of moving toward a better system. I urge my colleagues to show that courage so we can turn to a better way, to lower health care costs, to increase health care choices, and ultimately to improve the quality of care for all the families that we represent. Madam President, I yield back my time.